Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report today. The total number of cases remains at 281. The total number of COVID-related deaths in Manitoba remains at 6. As of this morning, 5 individuals are hospitalized, none of which are in intensive care. 238 individuals are listed as recovered. There are 37 active cases. Yesterday, 642 laboratory tests were performed, and that brings the total to 27,446 tests. We've continued to increase our testing capacity, and any symptomatic Manitoban can be tested at this point. So again, any Manitobans experiencing respiratory symptoms, fever, cough, sore throat, runny nose, can present for testing. We have plans to gradually restart the economy and allow some non-essential businesses to return to operation with restrictions. It needs to be noted that this is not a return to normal, that this is a gradual and cautious reopening of the economy with very stringent restrictions at first to continue our limitation of the transmission of this virus. We can't let our guards down at this point. We need to continue the very important activities of washing our hands frequently, maintaining physical distancing when we're out, and what's going to be very, very important, what's vital moving forward, is that individuals who are experiencing symptoms, people who are ill, need to stay home. Call for health links for advice, call your healthcare practitioner, but those experiencing respiratory symptoms cannot go to work, cannot go out shopping, need to stay home and be assessed at a healthcare facility. It's important that we do not have people who are showing symptoms of respiratory illness in workplaces or in other public areas. Staying home with your immediate family is the best way to protect yourself and others. If you're going back to work, there are options for daycare. Licensed centers can take up to 16 children. Home-based centers can take up to 8, and there are spaces available. There's an online tool. Visit eswchildcare.ca or follow the link in our bulletin to view available spaces. So right now, we're still advising to stay home as much as possible. This is vital for people who are at increased risk of severe outcomes with this virus. So those over age 65, those with underlying medical conditions such as cardiac or respiratory conditions, those with immune compromise need to take extra care. Should stay home as much as possible, limit your exposures to others, ensure you're physically distancing when in public. Businesses that have questions about how the orders apply to them should visit engagemb.ca for more information. We continue to encourage Manitobans to visit our website for up-to-date credible information, manitoba.ca/COVID-19. And so thank you again to all Manitobans for stepping up to flatten our curve. But our battle against this virus is not over. This virus is still here in our province, so we need to do whatever we can to limit the transmission of it. And those steps of staying home when you have any symptoms, washing hands frequently, physically distancing when in public. If you're meeting with friends and family, do so outside. Do so in a physically distanced way. And do not attend any gatherings when you're showing any symptoms of respiratory illness. And so thank you very much, and I'll pass it over to Lynette.
Thank you. Good afternoon. I'm Lynette Siragusa from Shared Health. I would like to begin today by thanking CAA Manitoba, who organized a procession of tow trucks a few days ago that ran past HSC Winnipeg, Grace Hospital, and Fire Station Number 1. They were joined by a number of other organizations within Winnipeg's tow truck industry, including Dr. Hook, Crane and Champion Towing, Tartan Towing, and All Rig. We have seen a number of these types of parades in the past 2 months throughout our province, and this show of gratitude and respect for our healthcare workers and first responders is always appreciated. It's a great reminder for those frontline staff that they are not alone in this fight, and we are all in it together. So thank you very much for your continued support. I want to talk about the reopening as we ease various restrictions within the healthcare system. Some services will begin to open and ramp up activity slowly over the coming weeks. I would just like to remind everybody that this is not a return to normal. All clinical services that can be delivered virtually should be delivered in that way. Screening of staff and patients for symptoms will continue, as well as appropriate PPE must be utilized. Some surgical and diagnostic services that began to be postponed about a month ago will now start to be scheduled and performed. And I will provide an update on the impact of COVID-19 on the surgical and diagnostic volumes later this week. But I do remind everyone that this is a gradual resumption of services using a phased approach that addresses the highest priority patients first. All Manitobans should still take the necessary precautions to prevent the spread of the virus, including physical distancing, strict hand hygiene, and staying home if you are ill. This also includes the restrictions of visitors to our healthcare facilities as part of our effort to prevent the spread of COVID-19 within our acute and long-term care areas. As Manitoba cautiously begins a phased reopening, we are very committed to continuing to reevaluate the restrictions and determine when we can safely reduce or lift these. We appreciate that Manitobans understand that we need to continue our efforts and protect all of our patients and residents. And we very much look forward to being able to welcome loved ones and volunteers back to our facilities as soon as it's safe to do so. Our online portal for lab testing allows those patients who have negative COVID tests to access their information online. That is up and running as of today. There is also information available on this at sharedhealthmb.ca/COVID-19, and you can click on your test results if you recently had a test. Users will need a Manitoba Health registration card in order to access their online results. For those who don't have a Manitoba Health card or don't have access to the internet, you can call toll-free to get your results. And the number is 1-844-960-1984. And this phone line is operated by our COVID-19 contact center. It's available 7 days a week from 9 a.m. to 5 p.m. And it is our goal that this initiative will allow Manitobans to have faster access to negative results. And we also hope that it will relieve some of the stress and anxiety of anyone who's been tested. There is no change to those individuals who test positive. They will continue to get a phone call as soon as possible from the public health team, and they will provide instructions and as to what needs to be done with a positive result. And finally, I just want to mention that it is Mental Health Week across Canada, and it's important to note that those who need mental health services, they are available, they are offered, and there are some virtual modifications that are available during the pandemic. So the mental health and crisis support services are available throughout the system, but also with our partner organizations across the province. And this also includes children and youth services through the Manitoba Adolescent Treatment Centre. We also have the Ability CBT program, which launched in Manitoba last month. And this program provides confidential virtual therapy for people who are experiencing mild to moderate anxiety. It's guided by professional therapists. It does not require a referral from a doctor, and it is free of charge to all Manitobans who are 16 years old and adults beyond that. The program can be accessed at manitoba.ca/COVID-19. As well, there are a number of employee assistance programs for healthcare staff. So no matter where you work or what you do, it's okay to ask for help. And like all things related to COVID-19, we are in this together. And with that, I will open up the lines to questions.
Thank you. We've had a couple of issues with our phone lines. Hopefully all our reporters are still on board. And a reminder, you will have an opening question and one follow-up question. Up first, from the Winnipeg Free Press, Carol.
Test positive for COVID-19 about their race, ethnicity, and/or Indigenous identity. But since April the 2nd, public health ministers have had instructions for surveillance, the form that required them to ask those who test positive about their Indigenous identity and First Nation status. Have they been asking that question since the beginning of April?
That's for as far as Indigenous self-identification, that has been on since the beginning of April. The other identifiers, the work to engage various communities was ongoing. So now it's broadened that broadened the capture of that data.
And how many have responded saying that they're Indigenous or First Nations?
Yeah, that we haven't been reporting on that as of yet. We're going to still, work with our partners, Indigenous partners, on and how and when we might disclose those type of things.
Can you say why?
Yeah, because that's their data. The Indigenous people are partners, and so we would work only in partnership with them before we released any of that data.
From the Brandon Sun, Drew.
Thank you. It's Drew May from the Brandon Sun. With this new portal that people can access their test results on, will people have to go there to access their results, or will they also be getting a call telling them whether or not they can get it, or they tested positive?
Yeah, no, they should be either calling themselves to that 1844 number, or they can go online to get the results. I guess they could call. I think that would be the best approach. So we did have Dynacare offering calling for the past month, but it wasn't really, there were some challenges with that, and not Dynacare's fault, but just being able to contact people. So we thought it would be easier for people to contact us and get that information as soon as possible.
And just as a follow-up, with that in mind, is there any concern there that introduces uncertainty into people's results if they have to go themselves instead of, them getting a call from the province?
Well, they would get a call if they were positive, for sure. But if they were negative, as we look to increase the test volumes, we're looking at going potentially 1,500, 2,000 tests a day is our goal. That's a lot of trying to call people, and lots of times they weren't able to get a hold of them, or the number was wrong. So this way it really puts the power to the patients, to the people who had the test, and they can go online and look or call, whichever they prefer.
Thank you.
From CJOB, Diana.
Good afternoon, Diana from 680 Security. Dr. Roussin, obviously camping reservations are open. That kind of brings up a similar question of fishing. So with opening day set for this Saturday, will boat launches be open as normal, and will there be inspectors there to make sure everyone's kind of following the rules as far as physical distancing?
Yeah, so I don't, there's a number of launches around, so, certainly we have the ability to enforce a number of the orders. They're, where the officers will be at any one point. I can't really know that, but certainly there's the orders are in place. They are enforceable, and so people will be held to account. But our numbers show that Manitobans have already known how important this is. The Manitobans have been following the rules, and we'd expect them to continue to do so.
And kind of just following up on that, are there rules about how many people are able to be in a boat at any one time? Do they kind of have to keep that 2 meters apart? Will that sort of thing be patrolled?
Well, certainly the group sizes are certainly enforceable under the Act. Or under the public health orders. So there certainly could not be group sizes of greater than 10. The physical distancing strategies are guidelines. That's what we are advising Manitobans. So that's less something that can be enforceable, but that's a strong guideline, and Manitobans have been adhering to it.
From the Winnipeg Sun, Scott.
Scott Billick here, Winnipeg Sun. Question, I guess, for Dr. Roussin, and I'm probably going to butcher the name of this drug, but is Manitoba planning on using, or are you already using, I believe it's remdesivir?
Yeah, remdesivir is a nucleoside analog, and so it's still in the research stage, so it's not an approved medication yet. There's been some early studies that show some promising results in the severely ill, but it's really early, so no, we're not using it certainly in routine practice, and I don't think there's anyone here involved in a trial, but it's really early on, and so certainly this cautious optimism with these type of medications, and but we'll have to wait for more evidence to show its effectiveness.
Okay, thanks. And my follow-up is, so Health Canada did a 180 this weekend on Spartan cubes, and now limiting them only to research. I know the province made an order, and so maybe, I don't know, maybe both can answer on this, but how does that affect the order that was made? Are you able to cancel that order, or do you still want these Spartan cubes for that research process?
Yeah, so when we first had some cubes here, it was really for the research purposes, for the validation, and that's why these things need to be validated. And right now there was some reports of underperformance, and so we don't have a large number of Spartans right now, and I don't have the details on any order that we have, but certainly at this time. It won't be a part of our testing strategy until better results are available.
From CBC Radio Canada, Mohammed.
Hello, Dr. Wilson. It's Mohammed from CBC Radio Canada. I have a question about daycares. Can you confirm that you had a meeting with daycares last week? And if yes, what was this meeting about?
Did I have a meeting with daycares last week? I don't think there was. I know I did have a town hall session with childcare, people involved in daycares, the people who work there. I think that was a couple of weeks ago, and it was just to answer questions about ways to protect against the transmission of the virus, things such as personal protective equipment, and just basics about the virus itself.
And just as a follow-up on this question, what measures should daycares take to reopen, and when do you think that they could do so?
So the going back to normal daycare services, that's not something that's going to happen in this phase. It's something that we continue to look at over time. The big things that that would be useful for daycares, or what's useful everywhere, is that screening of people, right? So no one with illness should be attending, and that includes children or employees. Frequent hand washing, physical distancing when possible. Certainly, there's some limitations of that in younger kids, but there are strategies to limit certain things, and a close look for symptoms on anyone during the day. So we know this virus is spread through close, prolonged contact, but predominantly through people who show symptoms. So it's very, very important that no employees are going to work with even mild illness, and no children are allowed to attend if they have an illness. So those are the real big things going forward, and that's really going to apply to any workplace. That's going to apply to any public place. It's going to be very vital that people not go out when they're ill.
From CBC Manitoba, Aidan.
Hi, good afternoon. Aidan from CBC News. My question is for Dr. Roussin. We've heard from lots of businesses who still feel like they don't have the information they need to reopen safely. Examples have been, like, can clothing retailers allow people to try things on? What should patios do, restaurant patios, if they've just taken a bunch of orders and it starts pouring rain, for example? So businesses say they don't have the facilities they need, and so what do you expect businesses to do to try and figure this out?
Yeah, so we have a number of resources available to businesses, and they can certainly contact us at engagemb.ca. But the issue here is that the tough public health restrictions that were needed to put in place, they can't be in place forever. They have negative effects on health as well. And so we were committed that as soon as we felt that those orders could begin to be loosened, we were committed to Manitobans to start just that. And so there's questions on, why not delay it a couple weeks? But again, and these orders have effects on health. We need to start reopening the economy cautiously, gradually, and so that will mean that a lot of detailed type information for these businesses we can deal with, but we were really committed to trying to reopen things as soon as we could, as soon as we thought it was safe, and we've provided a lot of information on the website, and there are a lot of resources for these companies to reach out, and we can guide them further.
Okay, thank you. And so my follow-up would be also on reopening. I feel like there's still a little bit of confusion among the public about how they should behave when they're out there. We've heard anecdotes, for example, of already over this weekend, before Phase 1 even began, people seeing like a family of 4 shopping together at a garden center over this weekend. So is that something you want to see? And what clarity can you give people about how they should behave, not just how they can behave?
Yeah, so this is a gradual reopening, and like we've said, it's not a return to normal in any way. And so this virus is still in Manitoba, and we need to keep our guards up to minimize the transmission of this virus. And the more crowding we have, the more contacts between people, close, prolonged contacts, then the more risk we have for transmission. So again, it's not a return to normal. I would advise against family shopping trips if they're not necessary. You can have still just the one member of the family, if possible, to do that is best. To certainly be very aware of any symptoms. Even mild respiratory symptoms, we need people to stay home. We cannot be shopping or in groups with symptoms. And so, it's the physical distancing is still important. We're able to reopen things quite gradually, but we're doing so in a manner for the most part, to allow that physical distancing to continue to occur. And so we need to still be aware that this is not a return to normal. People need to keep that physical distancing on their mind.
From the Canadian Press, Steve.
Dr. Roussin, Steve Lambert from the Canadian Press. Following up on the question about the patios I asked you last week, if I am a restaurant owner and I have a patio am I supposed to require people sitting at the same table to be 2 meters apart? And am I supposed to try to ensure that only members of the same family group sit together at a table?
Yeah, so this is the difference between what's an enforceable public health order and what's public health advice. So the public health order would require them to be operating at 50% capacity, and all tables need to be 2 meters apart. Certainly, sitting at a table, it's going to be tough to have people situated 2 meters apart. A public health advice is that, yeah, this is not a return to normal. We're not advising people go gather with groups of people outside their household and even go sit on a patio at the same table together. Certainly, we're not going to be putting that on restaurants to try to figure out who's from the same household or not. So it's not going to be an enforceable order, but it's not a return to normal. This isn't still the place where you'd get together with 10 of your friends and go sit on a patio at the same table. This isn't that return to normal yet. And so there's the orders that are enforceable, and then there's the strong public health advice.
And on the enforcement front, can you tell us what enforcement measures are in place regarding the ban on non-essential trips to the north by Southerners? Are there ways of tracking people at either airports or along Highway 6 and other highways?
Yeah, so right now it's the order is certainly enforceable. It's there, and there's many options to be able to enforce it. But what we see is that Manitobans have been following our plans all along. They've been following our advice. They've been following the orders. So the enforcement is something that could be a possibility, but right now we don't have anything in place that's tracking people or anything of that. So it's certainly enforceable, and if we're getting reports of issues, then we can certainly follow up with that.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. Just wondering what your advice would be to somebody who might be feeling a little bit nervous about all of this.
About the reopening strategy?
Yeah.
Yeah. So I mean, I think this isn't a return to normal. We still need to be wary of this virus. Manitobans, we've been put in a good position. Manitobans have stepped up and put us in a good position to be able to gradually reopen this, and so we're going to follow things very carefully. We have the ability to roll things back if necessary, but if we're following the guidance that's put out, we really feel this is a safe plan forward. We have a lot of physical distancing in place. I think Manitobans are very astute to things like the symptoms right now. They're very astute to the need for physical distancing. And I think businesses are on board. Businesses don't want to be responsible for the transmission of this virus. So I think we've put ourselves in a good spot to gradually reopen it, but we're going to do so cautiously, and we're going to watch those numbers very closely.
Okay, thank you. Also, can you give us a timeline at all when you would start reconsidering interprovincial travel?
Like when we would reduce the order for the 14-day self-isolation?
Yeah.
Yeah, so that's the travel restrictions are going to be with us for a while. We're going to be following things really closely. So there's certainly a northern travel restriction. We need to do whatever we can to limit the introduction of this virus into remote isolated communities. And as far as the interprovincial travel is, right now our epidemiology is better than certain other jurisdictions, and so we're still at risk of the introduction of the virus, the importation of the virus into Manitoba. So we're going to keep those restrictions in place so that we can gradually reopen things here, knowing that we're doing whatever we can to limit the importation of the virus.
From City News, Jonas.
Dr. Roussin, just kind of more of an overview of where we are today based on where we started. I mean, if we had come into this reopening on the back of 10 straight days of single-digit caseload when we first started,
Would that have surprised you in a good way? Are we ahead of where you expected us to be right now?
Yeah, I think that going into things like a pandemic, you understand that it's going to be very difficult to predict where we are. So I think that our geography, our timing, really allowed us to get ahead of this. So I think that certainly if you showed the curve where it stands now at the beginning of this and compared to other jurisdictions, it probably is not what we had expected. So I think it's Manitobans have put us in a position right now where we are at the right time to start gradually reopening things. But again, very cautiously, we still have to deal with this virus, and we will for quite some time.
Absolutely. So I guess folks that may be hoping to go to the cottage in, say, northwestern Ontario at some point this summer, maybe out of luck for quite a while.
Well, I think that the public health orders for the travel, they don't restrict interprovincial travel. They will require the 14-day self-isolation for those who are certain groups are excluded with that. So it's hard to predict. We have information for cottagers on our website, and the guidance really is. If you're leaving the province, is to really leave no trace, to not visit, towns, not visit retail outlets when you're out of province. Certainly within the province, we have some guidance there to, if you do visit cottage country and these areas, you need to be responsible. You need to not be going there when you're feeling ill. You need to be washing your hands. You need to respect that physical distancing at all times. So there is these opportunities, but we have to do them very carefully, and it's vital that people don't travel, don't leave the home really, other than medical appointments, if you have symptoms of respiratory illness.
Thank you. We have a few moments left. If any of the reporters online have other questions, please ask them now.
Hi, Dr.
Hi,
Aidan
from CBC.
I just have a question about the province opening up and the long-standing concern about the vulnerability of First Nations, and if the virus lands on a reserve. Why can't you release that information so that people know what the actual risks are now, especially with the province opening up, about First Nations people and the travelers back and forth to remote communities that are so vulnerable? How is this not information that's for the public good?
So releasing the data on cases that have self-identified as First Nations is what you're asking. So we don't have a case in a First Nation community, and those type of numbers. I think it's clear that when we collect this information, that's data is not ours. That's our Indigenous partners. That's their data, and so we will work with them. But I would only release such numbers in collaboration with our Indigenous partners.
It's their data, but aren't public health nurses asking the question?
Well, those who are working in the field, who are doing contact tracing, are well aware of the cases and contacts. To announce that publicly. We're only going to do that collaboratively.
Scott Phillips from the Sun here. So I just looked back. So on April 20th, I don't know if either you or Lynette said there was an order coming of these Spartan cubes by mid-May. Is that order still coming, or has that been canceled?
Well,
We'll have to look into that. I'm not sure if they're still coming, if we can cancel the order. I'll follow up, Scott, and get back to you.
Okay, thank you.
Aidan from CBC News. I just want to look back to the Spartan cube. I know that the cube is being researched and validated within Manitoba as well, and I was wondering if Manitoba research found the same issues of unreliability as the federal research did.
Yeah, I think that it was consistent across the nation. There was concerns about the validity at this point, and so that's what led to these actions.
And Aidan from CBC again. I have another question for Dr. Roussin. We heard from some dentist office who have said that they donated all the PPE that they had, or a significant amount of the PPE that they had a little while back, and now they don't feel that they have enough to reopen safely. And so I'm wondering, why not give more advance notice ahead of reopening to high-risk jobs like dentistry?
So the notice. So again, these are loosening of restrictions. They're not directives. And so there's a few ways of looking at it, and certainly we looked at both ways. We loosened the orders when we could. Right, we couldn't engage a week before we lifted them because they weren't ready to be lifted, and we didn't know they could be lifted. So we're following the numbers, and as soon as the numbers were guiding us to say it's a safe time to start loosening things gradually, then we did that. If we delayed it, a week or two, then we could also get the same question as why are we keeping things shut if our numbers say it's safe to start to open them? So it's a balance. We wanted to loosen them as soon as we could. A Public Health Act requires us to only have measures in place that are proportionate to the need. And so as soon as we felt that the orders could be relaxed appropriately, then we did, rather than delaying. And so again, it's a loosening. It's not a directive. No one's being forced to start work today. It's just that they're not being restricted in the same manner.
This is Drew with Brent Roussin. On the topic of the Spartan Keeps being recalled, does that affect the province's expanded testing capacity or the pledge to triple the amount of tests we can do by the end of the summer?
That really won't have a huge impact. So those tests are, point of care. They're rapid, but they don't have the throughput of the lab testing. So the sheer numbers weren't going to be high. It was just the utility of where they could get those rapid tests. So it's not expected to affect our total testing numbers very much.
We have time for one more question. Well, thank you. This concludes today's media briefing.